Okay, today we will be seeing about post-endodontic restoration. These are my contents. Coming to the introduction, there is a greater deformation of a pulpless tooth with an extensive cavity than in a sound tooth under a similar load because a dead tooth contains about 9% less water, which diminishes the elastic recoil of the dentine. Therefore, there is a potential risk for tooth fracture under stress. It is, it is imperative that the risk of fracture be foreseen and prevented both during the endodontic treatment and subsequently. Coming to the changes in endodontically treated teeth, the number one change is loss of tooth structure and then altered physical characteristics and altered aesthetic characteristics. So, the important considerations include the amount of remaining tooth structure, the, the anatomic position of the tooth, the functional load on the tooth, the aesthetic requirements for the tooth, and the various combinations of the support. Coming to the amount of remaining tooth structure, teeth with minimal remaining tooth structure present several clinical problems. These may include increased root fracture risk, greater potential for recurrent caries after restoration, higher occurrence of final restoration dislodgement or loss, increased incidence of biological width invasion during preparation of the tooth. Biological width is defined as the distance measured from the base of the gingival sulcus to the alveolar crest. So the average biological width is 2.07 millimeter. So the restoration impinging on the biological width will result in loss of the attachment and pocket formation. Coming to the anatomical position of the tooth, coming to anterior teeth, intact non-vital anterior teeth that have not lost tooth structure beyond axis preparation are at minimal risk for fracture. They do not require a crown, core, or a dowel. A non-vital anterior tooth has significant tooth structure loss and requires crown. Coming to the posterior teeth, they carry greater occlusal loads than anterior teeth, and restorations must be planned to protect the teeth against fracture. The functional forces against molars require crown or onlay preparation. When there is sufficient tooth structure to retain the crown and core, dowels are not needed. If there is insufficient tooth structure to support the core and crown, dowels are mandatory. Coming to the functional load on the tooth, abutment teeth for long span fixed bridges and distal extension, removable partial dentures absorb greater transverse loads and require more protection than do abutments in small bridges. Teeth that exhibit extensive wear from bruxism, heavy occlusion, or heavy lateral function require the full complement of dowel, core, and the crown. Coming to the aesthetic requirements, anterior teeth, premolars, and often maxillary first molar inhabit the aesthetic zone of the mouth. Teeth in aesthetic zone require careful selection of the restorative materials, careful handling of the tissues, and timely endodontic intervention to prevent darkening of the root as the tooth loses vitality. Coming to the basic components, we see the crown, which is the outermost protective uh, cap structure, and inside the crown, in order to support the central part of the crown, we have the core, and like post, the dowel is seen. Coming to the definition, post refers to a cylindrical or tapered object that fits into the prepared root canal of a tooth and is synonymous with the term dowel or endodontic post. Coming to the core, core refers to a build-up restoration, usually made of amalgam or composite, placed in a badly broken down tooth to restore the bulk of the coronal portion of the tooth to facilitate subsequent restoration by means of an indirect restoration. Coming to the ideal properties of the dowel, the ideal properties of dowel are maximum protection of the root, adequate retention within the root, maximum retention of the core and the crown, maximum protection of crown margin cement seal, pleasing aesthetics, high radiographic visibility, retrievability, and biocompatibility. Coming to the dowel classification, depending upon the preparation, custom made cast post and cores, prefabricated post and cores. The prefabricated post and cores are divided into metallic and non-metallic types. Among the metallic prefabricated posts, non-threaded and threaded posts are seen. Among the non-metallic prefabricated posts and cores, it may be ceramic or made of carbon fiber or fiber reinforced resin. Depending upon geometrical configuration, it may be the post may be tapered or parallel. Depending upon the surface configuration, the, the post may be smooth or serrated or threaded for retention purposes. Commercially available post systems are tapered, smooth-sided post system. Example, Kerr endo post, parallel-sided serrated post systems. Example, Walden para post and tapered self-threading post system. Example, dentate screw, parallel-sided threaded post system. Example, radix anchor and curer anchor, parallel-sided threaded split shank post system. Example, flexi post. So here we see different kinds of serrations and threadings in the post which is given for retention. Coming to the indications, in case of anterior teeth, where the natural crown of a root-filled teeth either has been lost or is extensively damaged, where the root-filled tooth is to be used as a bridge abutment, where a change in the axial position greater than 1 mm is required, a crowned anterior endodontically involved tooth to reinforce the crown covered tooth at cervical area susceptible to fracture, loss of two proximal surfaces with a lingual access opening which weakens the tooth. In case of posterior teeth, indicated when the remaining coronal portion is less than 50% and sufficiently long, thick root structure is present, indicated when the root filled tooth is to be used as an abutment for a bridge. In case of malpost teeth, when the preparation of tooth would cause exposure of the pulp, indication when restored bicuspids which are endodontically involved, that is the premolars, and in case of shortened tooth due to the nature of destruction or removal of undermined undesirable tooth structure, and in case where there is vital tooth with insufficient retention in case of conventional crown. Coming to the contraindications, it may be due to severe curvature of the tooth, we cannot give such posts. Maybe due to the persistent periapical lesion, we may not give post and add additional load to the tooth structure. And in case of poor periodontal health or poor crown root ratio or weak or fragile roots, and in case where the teeth with heavy occlusal contacts are seen, and in case of patients with unusual and occupational habits, and in cases of economical factors of the patient, and in case of inadequate skill. Coming to the retention form, for the retention form, the following factors are considered: the post design, post length, post diameter and remaining dentin, surface preparation of the post and the canal, cement placement and luting cements. Coming to the retention form, the post design, in case of in case of post design, actively threaded posts are more retentive than passive parallel uh, posts, and the passive parallel probes are more retentive than passive tapered posts. And in case of post length, the more the length, the more is the retention. Ideally, length of the post is equal to the crown length or at least two-thirds to three-fourths of the length of the root. Coming to the post diameter and remaining dentin, it is divided into three types, that is conservative, proportionist and preservationist. The more the diameter, more is the retention, but more is the fracture susceptibility as well. Ideally, diameter, the post diameter which is less than one-third of the cross section of the root is suggested. Coming to the retention form, the conservationist approach advocates minimal canal preparation and maintaining as much residual dentin as possible, thereby suggesting restriction of the post diameter in an effort to conserve the remaining tooth structure. In case of preservationist concept, the post should be surrounded by a minimum of 1 millimeter of the sound dentin. In case of proportionist, Stern and Hirschfeld suggested that the post width should not be greater than the root width at the narrowest diameter. So here we see the three concepts. The first one is the conservationist theory, and second one is preservationist theory, and third one is proportionist theory. Coming to the resistance form, it includes the ferrule effect, the vertical remaining coronal tooth structure presence, and the anti-rotation phenomenon. A groove or notch at the orifice of the canal in the region of maximum bulk is placed. Then it is called as anti-rotational notch or groove. Coming to the ferrule effect, a ferrule is defined as a band of extracoronal material at the cervical margin of a crown preparation that encompasses the tooth and provides resistance form to the tooth. This is usually provided by the crown that is placed over the post and the core system. 1 to 2 mm of the tooth tissue coronal to the finish line of the crown preparation significantly improves the fracture resistance of the tooth and is more important than the type of core and post material. So this is the schematic diagram illustrating the ferrule. There we see the minimum thickness of 1 mm in the ferrule, and the ferrule walls are almost parallel. Coming to the removal of endodontic filling material, the timing for removal of gutta is still controversial. It was previously believed that 24 hours to a week delay was required to avoid disturbing the seal. Recent reports reveal that adequately condensed gutta can be removed immediately. Coming to the core materials, it includes cast core, amalgam core, composite resin core, glass ionomer core, resin modified glass ionomer core. Ideal requisites for the core material are: it should have high compressive strength, the core material should be dimensionally stable, it should have ease of manipulation, and it should have short setting time and the ability to bond to both the tooth and the post, and the adequate rigidity of the core material with chemical stability and high radio opacity, and it should have biocompatibility, and it should be inexpensive. Coming to the cast core, a cast metal dowel and a core is the traditional way to restore endodontically treated teeth. The core is an inter-regional extension of the dowel. Advantages are: noble metals are non-corrosive, it does not corrode easily, and it has high strength and rigidity. Disadvantages are: it has higher rate of root fracture, the financial cost of this is very high, and 2 appointments are needed, and lab expenses also will be added to that. So the custom made cast post and core is recommended whenever more than 3/4 of the coronal tooth structure is lost. The prefabricated post and core systems are recommended when the loss is restricted between 1/2 and 2/3 of the coronal tooth structure. Coming to the clinical recommendation, glass fiber reinforced epoxy resin post system or more than 1/2 coronal structure tooth structure is lost means we can place glass fiber reinforced epoxy resin post system. In case of more than 2/3 coronal tooth structure loss, metal post system is recommended. Coming to the amalgam core, it is a traditional core build-up material with a long history of clinical success. The advantages are high compressive and tensile strength, high modulus of elasticity, high stability to thermal and functional stresses, easy to manipulate, and it is dimensionally stable, and it is contrasting color to the tooth. Coming to the disadvantages, it has significant potential for corrosion and subsequent discoloration of the gingiva or remaining dentin. It has high coefficient of thermal expansion, and it does not adhere to the tooth structure. And also it has very slow setting time and requires separate appointment for core buildup and tooth preparation. Coming to the composite resin core, the advantages include high compressive strength and reliable bond to the tooth structure, and it has commands its nature to allow immediate tooth preparation, and it is highly radio opaque and has ease of manipulation. Coming to the disadvantages, it has high coefficient of thermal expansion which results in potential for micro leakage. It is not dimensionally stable in wet environment. It has water resorption and absorbs water and expands, and the composite dries. Coming to the glass ionomer cores, the glass ionomer and glass ionomer silver are adhesive materials useful for small buildups or to fill undercuts in prepared teeth. The indications are: it is indicated in posterior teeth in which bulk of the core material is possible. It is significant sound dentin remains, and additional retention is available with pins, and the moisture control is assured, and the caries control is indicated. Coming to the advantages, in case it has good adhesion, it has good anti-karyogenic property and fluoride release property, and it is highly radio opaque. It shows a contrasting color to the tooth and high coefficient of thermal expansion similar to tooth structure. The disadvantages include: it has very low compressive and flexural strength, it has low fracture toughness. Coming to the resin modified glass ionomer core, Resin modified glass ionomer materials are a combination of glass ionomer and composite resin technologies. They exhibit properties of both the materials. The advantages include it bonds to the tooth structure well, it exhibits moderate strength, which is greater than the glass ionomer and less than composite resin. It is adequate for moderate sized buildups and it has good anti-karyogenic property due to fluoride release. The disadvantages include the strength still is not adequate as core buildup. It has high hygroscopic expansion and high solubility also. Coming to the luting cement used, cementation plays a very significant role in enhancing the retention, stress distribution, and sealing irregularities between the tooth and the post. The most common luting agents are as follows. That is the resin luting cement, glass ionomer cement, which is type 1, and resin modified glass ionomer cement, zinc phosphate cement. Zinc phosphate cement and type 1 glass ionomer cement have been successfully used for the cementation of ports for many years. The current trend is to employ resin luting cements. The advantages of resin luting agents are as follows. It has increased retention, high strengthening of the root, at least in short term, reduced leakage, and more resistant to cyclic loading, and its ability to bond with resin based posts to form one unit, that is monoblock. Coming to the disadvantages of resin filling agents, it is more technique sensitive and proper cleaning and etching of the canals, which root canals are obturated with eugenol containing sealers, is important to ensure proper polymerization. The steps of the bonding the post with such auto cured resin cements should be performed carefully. Thank you.